increased case counts, a rising 5-day test positivity rate, increased hospital and ICU admissions, evidence of broad community spread, and increasing percentages of VOCs.
It's a list of everything you don't want to hear in the pandemic, but it's where Manitoba is at, and modeling from the province shows that the situation in the ICUs are worse than their projections for worst-case scenario.
The number of ICU admissions is aligned with the extreme scenario. However, we have already seen a spike in admissions that goes above the projected levels.
Dr. Jazz Atwal says approximately 25% of patients remain in the ICU longer than 2 weeks and can stay up to 7 weeks, which means that even if Manitoba on the whole adheres to the lockdown, we won't see cases peak for a week and won't see ICU numbers peak for 2 weeks to a month.
Case numbers have increased by about 33% per week. The ICU numbers have increased by about 20% per week, and the hospitalization numbers have increased by about 18% per week. If we're thinking that the cases are going to peak probably next week, that might be another handful of percentage points going up. The hospitalization numbers I would anticipate going up probably by about 18 to 20% next week, as well as the ICU numbers, and probably a little bit higher there afterwards the week after before they start to trend down.
Dr. Atwal says over the past few weeks there has been an increasing amount of young adults hospitalized who tend to stay there longer.
Roughly 50% of our daily hospital admissions for COVID-19 are in those less than 50 years of age. And in this group, roughly 1/3 of people are less than 29, 1/3 are in their 30s, and 1/3 are in their 40s.
And with that comes a system that continues to be strained and a plea for Manitobans to help stop the spread of COVID-19.
My physician colleagues in ICU and emergency rooms right across the province are asking, public health is asking for Manitobans to limit those interactions.
The models project that immunizations will be able to control the spread of COVID-19 in the long term. The province says they plan to release modeling data more regularly. In Winnipeg, Mike Albanese, City News.